So I was in the Marine Corps for 6 years, served up and down the West Coast and in Southeast Asia. I'm proud of my service, I'm proud of my country, and I would go do it all again. My front teeth were knocked out by an anesthesiologist who was taking breathing tubes out of my mouth after the surgery was complete.
When Chris came to me, he shared that his teeth had been knocked out traumatically during a procedure where he was having a lung biopsy. And the doctors, when they pull the tube out, I mean, it's something that happens, unfortunately, but his front teeth got knocked out. With Chris's situation, they tried to fabricate a bridge for him, but just due to his bite and some issues with his other teeth, that just didn't work. And what we're going to be able to do is take out all of his upper teeth. We're going to be able to place some implants, and that same day, we're going to be able to give him fixed teeth on his implants, which, I mean, it is just going to radically affect his life and his outlook on himself. And I mean, I can't wait to see his smile and just his enjoyment, you know, of life after his procedure. As a board-certified oral and maxillofacial surgeon, I work at DFW Oral Surgeons in Flower Mound, Texas. We're going to be managing Chris's surgery with Dr. Ray Rodriguez, who's a board-certified prosthodontist who practices in Dallas, and I'm also going to be working with Reinhard Venter, who is just a phenomenal lab technician. As an oral and maxillofacial surgeon who practices in a very high technological office, we have the ability to actually place the dental implants before the surgery is performed. I've already sat down with Dr. Rodriguez and shown on the computer where we're going to place those. Dr. Rodriguez has already personally set all of the teeth in wax, and then he actually took those teeth and fabricated the temporary teeth with those.
You know, kind of reflecting on past cases that we've done and patients that we've dealt with, this is huge. You know, you're basically restoring not just a set of teeth, but you're restoring life. And, you know, people have a chance to, you know, smile more, happier, they can eat more, function better. It generally has more of an impact than what they realize it actually will have on them. And that's been the common consensus for me. Kind of, you know, sometimes when we get into life, into things, you don't always know what the fruits of it will be, you know, and I don't know it would be this impactful when I got into this. So, you know, as we get into it more and more, I realized that, you know, there's a lot of reward in this just by, you know, helping people and, you know, doing such a huge procedure, you know, not just replacing one or two teeth, but a whole mouth.
Well, I think it's important to give back. I mean, I really enjoy what I do. I think it's important, part of someone's self-esteem. So it's important to me in the fact that when you see someone in need and they need your help, and this is the kind of work that you do, that you can kind of give someone back their self-dignity, their self-esteem. You know, now their bad teeth are gone, their pain's gone, they can eat what they want. There's a lot of studies that show a big tie between your periodontal health and your general health. So I feel that right now Chris did have some health issues, and so I think working on his teeth and getting those bad teeth out, getting the infection out of his jawbones would be do great strides towards getting him healthy in general.
As a veteran who served over 10 years in the U.S. Army as a dentist and then an oral and maxillofacial surgeon, I really feel it's my job to give back to veterans and their families who've really given their lives and given a lot for our country so that we can have the freedom and ability that I have to practice. This opportunity that I've been given to manage Chris's needs is really great because it helps me show the public what people who are in the armed forces actually go through, the struggles that they have after after they've served and obtaining care. I mean, this is something as an oral surgeon in Flower Mound and in the Dallas-Fort Worth area that I feel is needed, and I'm very excited about the opportunity to get to care for Chris.
I think Dr. Schellenberg is probably one of the finest men I've ever met. He's professional, but down to earth. He's easy to talk to, and he listens to you. And I think when you put all that together, you have a superior doctor. Doesn't matter what, it just is better. The staff is great. The doc is great. I mean, it's just a wonderful experience. And Dr. Schellenberg was able to pull together all sorts of people, supplier of the hardware, the lab. And that's the only way that I could get my life back, by having a good smile and better oral health. You people have seen me before with really awful teeth, and they don't make you feel good about yourself. And when this was done, it changed my whole perspective on life and the way to live it and the way I interact with other people. And now I just really enjoy smiling. I mean, it's just a wonderful experience. I've been around dentistry a long time, and I think this is the best, absolutely the best circumstances I've ever been in.